Hi, good morning, all of my viewers. Welcome back. Almost all of us are quite experienced that a baby frequently pees because it doesn't have any sense and it cannot control over the pee. So, a baby urinate or pee frequently. But imagine the case if it happens for a fully grown man or woman while going out in the marketplace or while traveling in the bus or train, and he or she has to urinate frequently in the public place. It's quite embarrassing, isn't it? Definitely, it is embarrassing. But the fact is that many of us in the society, particularly in the old age, they are suffering from this urination frequently in public place because of the intense urge and inability to control it properly. This disease is called urinary incontinence. Particularly, the old age peoples are the most sufferers. Before going further in these discussions, let me tell one disclaimer that I am not a medical doctor, but since some of my close old age relatives are suffering from this urinary incontinence, so this urged me to search from the internet, and this video is for the purpose of general information to common people in simple language. So basically, there are four types of urinary incontinence. The first type is stress related incontinence, when it happens because the urinary bladder is subjected to stress or pressure. Second type is the urge related. The involuntary loss of urination happens because of the neurological disorders or diabetes. The third type is overflow type. Overflow type of incontinence, where the patient always feels the urge of urination because he thinks that the bladder is totally not become empty. So frequently he goes for urination. The fourth type of the things are the functional type of incontinence, which may happens because of physical or mental impairment, as for examples in case of arthritis, when the patient before going to bathrooms take unnecessarily delay for opening the button of the plant before urinations. There may be combination types also, where the stress and urge are combined. So, by definition, urinary incontinence is failing to control the urination, and this failure of control of urination happens because of malfunctioning of the sphincters muscles, which are responsible for opening or closing the valve of urination. So, for the persistence or the durations of this problem happening in the patient, there are basically two types of incontinence. One type is the temporary incontinence. It may happen because of urinary tract infections, constipation, or excessive laughing, coughing, sneezing, or because of taking diuretics. Diuretics are the substance which stimulates the bladder for urinations, and in fact it increases the volume of urination either. So some common examples of diuretics are alcohol, caffeine, carbonated drink and sparkling water, artificial sweetener, chocolate, chili powder, spicy, sugary or citrus food, that means excessive intake of vitamin C. So, what are the implications of this urinary incontinence? The frequent wetting of that place of urinations, there may be rashes of the skin if we do not clean the skin frequently, that area, and there is a chances of again happening urinary tract infections. And another Persistent type of incontinence are uh, pregnancy type of incontinence, where because of the pregnancy and weight of the baby inside the fetus, it exerts the pressures in the urinary bladder. So, the female patient of childbearing age during pregnant state feels the urge of urination frequently and doesn't control. During childbirth, particularly normal delivery, that nerve and muscles in pelvic area becomes weak, and in fact the pelvic floor prolapsed. Prolapse means it goes downwards, including the bladder, rectum, uterus, all goes downwards. And because of this imbalanced conditions inside interiors, the incontinence happens. It may happens because of the menopause also in women. During menopause, production of estrogen reduces drastically, and estrogen is responsible for making the healthy and strong muscles in the pelvic area. So, during the menopause, that area becomes weak. In case of aging, incontinence happens both male and female. For enlargement of prostate gland also, it may happens in case of the male. It also happens because of the restrictions of the urinary path by enlarged prostate. Enlarged prostate is due to the benign prostatic hyperplasia (BPH), where because of the cell divisions of the prostate gland excessively, the prostate increases in volumes and which physically restricts the urinary path. There might be the prostatic urethral strictures also, where urethral path or urine path becomes narrow and the stream during urinations becomes also very weak. So, urination never completes. It may happens because of the overweight also, because of smoking also. So, what are the precautions? If we do some allied exercise and some particularly pelvic exercise also, it may improve conditions. If we maintain the healthy weight and we limit the use of diuretic substance as a food, and if we use the fibrous food as much as possible, in that case it can be under control, and smoking also should be prohibited. So, what are the avoiding techniques so that old age peoples can get rid of embarrassment? So, one very common technique is that double voiding. Double voiding means waiting a bit even after completion of the urination by pressing the bottom side, so that complete voiding of the urinary bladder takes place. Another thing is the drinking sufficient water so that whenever there is urination, it completely empties out. Another thing is that old age people who are suffering in incontinence, they should urinate even before complete urge of these urinations. Thus, they can avoid this incontinence. Another thing is that nowadays adult diapers are available in several brands. So, the old age people can use undergarment absorbent also. I hope all these things are quite informative for you people, and it it will be beneficial for you people to guide the old age people in your home. Bye bye for the time being. I'll come again with some informations in next video. Bye for the time being.